Describe the method and how it is being used. Advantage and disadvantages of using it. Give the possible side effects or risks of using it. A. Artificial methods. Oral contraceptives. Oral contraceptives. Description. Oral contraceptive pills or OCP consist of the hormones progestin and estrogen or only progestin and must be taken orally once per day in order to prevent pregnancy. Currently, there are three different types available on the market. The combination pill, the progestin-only pill, and the continuous use pill. How to use it? The standard way to take the pill is to take one every day for 21 days, then have a break for 7 days. And during this week, you have a bleed like a period. You start taking the pill again after 7 days. Advantage. Some advantages of the pill include it does not interrupt sex. It usually makes your bleeds regularly, lighter and less painful. It reduces your risk of cancer of the ovaries, womb, and colon. It can reduce symptoms of PMS or premenstrual syndrome. It can sometimes reduce acne. It may protect against pelvic inflammatory disease. The disadvantages is it can increase your blood pressure. It does not protect you against sexually transmitted infections. Breakthrough bleeding and spotting is common in the first few months of using the pill. It has been linked to an increased risk of some serious health conditions such as blood clots, and breast cancers. Side effects. Oral contraceptives may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Nausea, vomiting, stomach cramps or bloating, diarrhea, constipation, and gingivitis, or swelling of the gum tissue, increase or decrease appetite, weight gain or weight loss. As you can see, these are the picture. The next is transdermal patch. So, these are the picture of transdermal patch. The description is a transdermal patch is a patch that attaches to your skin and contains medication. The drug from the patch is absorbed into your body over a period of time. If you'd rather not have a pill or an injection, a patch may be a more comfortable option for taking some medication. How to use it? If the patch protective liner contains two parts, first peel off one part of the liner, apply the exposed sticky part of the patch to the skin and press down. Next, peel back the second part of the liner and press the entire patch down. Place the patch sticky side down onto the clean area of skin. Advantage. Transdermal delivery offers several benefits. over oral delivery, including smooth, continuous drug delivery, increased bioavailability, and reduced drug interactions. Patches can be easily applied by the caregiver, and they provide a visual cue that the medication has been administered. Disadvantage: the patch is not a perfect means of contraception because of some drawbacks listed below. It does not provide protection against sexually transmitted infection or STIs, including HIV, must be prescribed by a healthcare provider. The estrogen levels are higher with the patch than with other hormonal methods. Side effects: disorientation, dry mouth, drowsiness, dilated pupils, dizziness, sweating, and sore throat. As you can see, these are the pictures of transdermal patch. The next is vaginal ring. Vaginal ring description. The vaginal ring or Nova ring is a small soft plastic ring that you place inside your vagina. It releases a continuous dose of the hormones estrogen and progestogen into the bloodstream to prevent pregnancy. How to use it? To use the vaginal ring is you squeeze the ring and insert it into your vagina, like inserting a tampon. It stays in your vagina for 3 weeks. You then take it out and throw it away and wait 7 days before inserting a new ring. Advantage: if used correctly, the vaginal ring is more than 99% effective. One ring provides contraception for a month. So you don't have to think about it every day. You can continue to have sex when the ring is in place. Unlike the pill, the ring still works if you have sickness or vomiting or diarrhea. Disadvantage: you may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. It may cause temporary side effects such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood changes. And the side effects is the same of disadvantages. You may not feel comfortable inserting or removing it from your vagina. You have a temporary side effects such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood changes. So as you can see, this in the picture is you can see the how look it the vaginal ring. So the next is subdermal implants. The description of subdermal implants is subdermal contraceptive implants involve the delivery of a steroid progestin from polymer capsules or rods placed under the skin. The hormone diffuses out slowly at a stable rate, providing contraceptive effectiveness for 1 to 5 years. The period of protection depends upon the specific progestin and the type of polymer. How to use it? The contraceptive implant is inserted beneath the skin of the upper arm. The implant releases a progestational hormone to prevent sperm from reaching the egg. To prevent sperm from reaching the egg. The implant typically suppresses ovulation as well. You can have a contraceptive implant inserted during a visit to your healthcare provider's office. Advantages: Advantages of progestin implants include long-term contraceptive actions without requiring the user's or provider's attention, low dose of highly effective contraception without the use of estrogen, and fertility is readily reversible after the removal of implants. So, disadvantages. You may experience temporary side effects during the first few months, like headaches, nausea, breast tenderness, and mood swings. Your periods may be irregular or stop altogether. You may get acne, or your acne might get worse. Side effects is nausea, stomach cramping or bloating, dizziness, headache, breast tenderness, acne, hair loss, weight gain, and vaginal irritation. Discharge may occur pain, bruising, numbness, infection, and scarring may occur at the site where the rod is placed. So, as you can see in the screen, that is the picture of subdermal implants. So the next is hormonal injections. Hormonal injection is the contraceptive injection prevents pregnancy by injecting a synthetic version of the hormone progestogen called dipot-medroxyprogesterone acetate or DMPA. The injection is also called depo. Depo prevents the body from producing its own hormones and releasing eggs from the ovaries. How to use? To prevent pregnancy, an injection must be given every 12 weeks. The injection is usually given during the first 5 days of the menstrual cycle, so it can start working straight away if you have the injection at some other time in your cycle. It can take up to 7 days to start working. Advantage: it does not interrupt sex. It's an option if you can't use estrogen-based contraception. You do not have to remember to take a pill every day. It's safe to use while you're breastfeeding. Disadvantage: your periods may change and become irregular, heavier, shorter, lighter, or stop altogether. This can carry on for some months after you stop the injection. It does not protect you against STIs. There can be delay of up to 1 year before your periods return to to normal and you can become pregnant. Side effects. Side effects can include weight gain, headaches, mood swings, breast tenderness, and irregular bleeding. Your periods become more irregular, heavier, shorter, lighter, or stop altogether. As you can see, you see the picture of hormonal injection. So it is liquid. Yes, it is liquid. So the next is intrauterine device. Intrauterine device, a small plastic T-shaped device that is placed inside the uterus. The small hollow pear-shaped organ in a woman's pelvis in which a fetus develops. To prevent pregnancy, intrauterine devices prevent sperm from fertilizing an egg and prevent fertilized eggs from implanting in the uterus. How to use it? The doctor will put the IUD in a small tube that they'll insert into your vagina. They'll move the tube up through the cervix and into the uterus. Then they'll push the IUD out of the tube and pull the tube out. String attached to the IUD will hang 1 to 2 inches into your vagina. Advantage. It protects against pregnancy for 5 or 10 years depending on the type. Once an IUD is fitted, it works straight away. Most people with a womb can use it. There are no hormonal side effects such as acne, headaches, or breast tenderness. Disadvantage. Periods may become heavier, longer, or more painful. Through this may improve after a few months. It does not protect against STIs, so you may need to use condom as well. If you get an infection when you have an IUD fitted, it could lead to a pelvic infection if not treated. UID stands for intrauterine device, shaped like a T and a bit bigger than a quarter, and an IUD fits inside your uterus. It prevents pregnancy by stopping sperm from reaching and fertilizing egg. The side effects is spotting between periods, irregular periods, heavier or longer periods, more or worse cramping during your periods, pain when your IUD is put in, and cramping or back aches for a few days after. As you can see, that is the form of UID. And how to put the device into vagina. So the next is chemical barriers. Barriers destroy pathogens on the outer body surface that at body of openings and or inner body linings, sweat, mucus, tears, and saliva all contain enzymes that kill pathogens. Advantage: barrier methods of birth control act as barriers to keep sperm from reaching the egg. Some barrier methods also protect against sexual transmitted infection or STIs. A few barriers methods or spermicide condom and sponge can be bought in most drugstores. Disadvantage: barrier methods of contraception are not as effective in preventing pregnancy as many hormonal methods of contraception. The reason for this is that barrier contraceptives are subject to being damaged and improperly used. For that reason, barrier contraceptives are only about 70 to 75% effective. Side effects: use of the diaphragm and spermicide may cause vaginal burning and irritation from the spermicide. Some people are allergic to spermicide or latex and may have a reaction. Use of a diaphragm and spermicide may increase the risk of urinary tract infection or UTI. So, as you can see in the picture that is the form of chemical barriers. That are the chemical barriers. Diaphragm or diaphragm method. A diaphragm or a cup is a barrier method of contraception. It fits inside your vagina and prevents sperm passing through the cervix or the entrance of your womb. You need to use it with a gel that kills sperm. Disadvantages: it's not as effectiveness as other type of contraception, and it depends on you remembering to use it and using it correctly. It does not provide reliable protection against STIs. It can take time to learn how to use it. How to use: with clean hands, put 2.2 cm strips of spermicide on the upper side of the diaphragm. Put your index finger on top of the diaphragm and squeeze it between your thumb and other fingers. Slide the diaphragm into your vagina. Upwards, this should ensure that the diaphragm covers your cervix. Side effects: from the spermicide, irritation of the vagina and surrounding skin, or an allergic reaction. Strong odors or vaginal discharge if the diaphragm is left in too long. An allergic reaction to the material in diaphragm. This is rare. A higher risk for urinary tract infection or UTIs. As you can see, these are the example of diaphragm method. Okay. Cervical cup. A cervical cup is a small cup made of silicone that fits over the cervix, the part of the uterus that opens into the vagina. It covers the cervix so sperm can get in and fertilize an egg. How to use it? The cervical cap keeps sperm from entering the uterus by covering the cervix. For added protection, spermicide is put into the cap before inserting the cap snugly over the cervix. The cap can be put in several hours before having sex and must be left in at least 6 hours after sex. Advantage: unlike the diaphragm, the cervical cap protects against pregnancy for 2 days or 48 hours, and for multiple acts of intercourse within that time frame. When placed appropriately, the cervical cap is often not felt by either partner during sexual intercourse. Disadvantage: the cervical cap is more difficult for women to learn to insert and remove the diaphragm if worn for more than 2 days or 48 hours. You run the risk of toxic shock syndrome or unpleasant vaginal odor and discharge. Mild allergic reaction to the silicone or spermicide occasionally occur. Side effects from the spermicide irritation of the vagina and surrounding skin, or an allergic react. Strong odors of vaginal discharge if the cap is left in too long. An allergic reaction to the material in the cap is the cap. Change in the cervix because of irritation. So the side effects is the same in other artificial methods. So the next is male condoms. Male condoms are a barrier methods of contraception. They are made of very thin latex or rubber, polyurethane or polysoprene, and are designed to prevent pregnancy by stopping sperm from meeting an egg. They can also protect against STIs if used correctly during vaginal, anal, and oral sex. How to use? Unroll condom all the way down the penis after sex, but before pulling out, hold the condom at the base, then pull out while holding the condom in place, carefully removing the condom and throw it in the trash. Advantage: male condoms reduce the risk of spreading sexual transmitted infections, including the human immunodeficiency virus or HIV. Condoms are often used to reduce the risk of STIs, even when the couple is using another method of birth control, such as pills. Disadvantage: some people are embarrassed to use condoms or feel they may interrupt foreplay or intercourse. Both partners must be comfortable with using a condom and be prepared to use one every time they have sex. Condom may decrease sexual sensation. Some people are allergic to latex or rubber. Condoms may break or leak. Side effects: most people can use condom with no problem. There are no side effects. Rarely latex or rubber. Condoms can cause irritation for people with latex allergies or sensitivities. As you can see, the picture is example of condoms. And the next is female condom. So as you can see, the picture of female condoms. Description: female condoms are a barrier method of contraception worn inside the vagina. They prevent pregnancy by stopping sperm meeting an egg. A female condom can be put into the vagina before sex, but make sure the penis does not come into contact with the vagina before the condom has been put in. How to use? While holding outside of condom at close end, squeeze side of inner ring together with your thumb and forefinger and insert into vagina. It is similar to inserting a tampon. Using your fingers, push inner ring as far up as it will go until it rests against cervix. Advantage: female condoms help to protect both partners from STIs, including HIV. When used correctly, they are reliable method of preventing pregnancy. It's a form of contraception you only need to use when you have sex. There are no serious side effects. So, disadvantage: some couples find that putting in a condom interrupts sex. To get around this, insert it in advance or try to make doing so a part of foreplay. Female condoms are very strong, but they may split or tear if not used properly. Side effects: there are no side effects. Female condoms do not have any side effects, except the individuals who are allergic to latex or rubber, or the sensitive on the vagina is less if have a female condom. So the last of artificial methods is surgical methods. Surgical methods: a medical procedure involving an incision with instruments performed to repair damage or arrest disease in a living body. Synonyms: operation, surgery, surgical operation, surgical process. Advantage: prevention of or improvements to medical conditions caused by a patient's obesity, surge in energy, increase life expectancy, increase self-esteem. Disadvantage: blood clot in a vein, deep venous thrombosis or DVT, bleeding or infection, bowel obstruction caused by scar tissue, leakage of fluid if opting for gastric banding, adverse reaction to anesthesia, nausea and vomiting, band slippage if opting of gastric bending, and gallstone. How to use? Many of surgical or surgery is the surgeon know how to use the surgical to the surgery. Side effects: pain during and right after surgery. A surgeon typically works with the anesthesiologist to manage pain using medication to block the awareness of pain, called anesthesia. Fatigue, appetite loss, problems with other parts of your body, swelling, drainage, infection, and bruising. As you can see, the picture of example of surgical methods. So we're here of the natural methods. Abstinence. Abstinence, this means avoiding all types of intimate genital contact. Someone practicing complete abstinence does not have any type of intimate sexual contact, including oral sex. How to use? People who are abstinent choose not to have sex. The official definition of abstinence includes not taking part in vaginal, anal, and oral sex. However, some people practice abstinence by only skipping one or two of those types of sexual activity. Anyone can practice abstinence at any time. Advantage: abstinence can be a way to avoid the risk that come with sex, like pregnancy and STDs, until you're ready to prevent and or handle them. Abstinence can also help you focus on other things in your life that are important to you, like friends, schools, sports, activities, having fun, and planning for your future. Disadvantage: causes you to miss out on the experience. It would make for difficult relationships. It can cause you lose motivation. It prevents you from having children. Experience show that even people committed to abstinence may unexpectedly have sex and may not be prepared to protect themselves from pregnancy and STIs. Many people may find it difficult to maintain abstinence over the long term. Side effects: anxiety and stress, memory, relationship, health, immune system, vaginal walls and lubrication, prostate cancer. So as you can see, these are the example of abstinence. So the next is calendar method. So calendar method is the rhythm method, also called the calendar method or the calendar rhythm method. Is a form of natural family planning. To use the rhythm method, you track your menstrual history to predict when you'll ovulate. This helps you determine when you're most likely to conceive. How to use. Record the length of 6 to 12 of your menstrual cycles. Determine the length of your shortest menstrual cycle. Determine the length of your longest menstrual cycle. Plan sex carefully during fertile days. Update your calculation every month. Advantage: calendar-based contraceptive methods prevent pregnancy by monitoring the fertile periods during menstrual cycle. The standard days method can be used by Any woman who wishes to prevent pregnancy and experiences regularly menstrual cycle menstrual cycles between 26 to 32 days in length. So the disadvantage, the biggest drawback is that it's not as effective in preventing pregnancy as other birth control methods. It requires you to be diligent in tracking and recording your cycle, and even then, it can be hard to be 100% sure what days you're fertile. Side effects: there are no physical side effects, and you can use it to plan when you get pregnant. You have to keep a daily record for your fertility signals, such as your temperature and the fluids coming from your cervix. It takes 3 to 6 menstrual or monthly cycles to learn the method. So it's so long to how to learn. As you can see, that is the calendar method, the example of calendar method. So the next is basal body temperature. So basal body temperature description. Your basal body temperature is your temperature when you're fully at rest. Ovulation may cause a slight increase in basal body temperature. You'll be most fertile during the 2 to 3 days before your temperature rises. By tracking your basal body temperature each day, you may be able to predict when you'll ovulate. How to use: take your basal body temperature every morning before getting out of bed. Use a digital oral thermometer or one specifically designed to measure basal body temperature. Track your temperature's reading. Plan sex carefully during fertile days. So, advantage: basal body temperature can be used as a way to predict fertility or as a part of a method of contraception by helping you gauge the best days to have or avoid unprotected sex. Tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effects. Disadvantage. What are the drawbacks of the basal body temperature method? The basal body temperature method may not accurately predict ovulation in all women, including those with irregular menstrual cycles. It offers no protection from sexually transmitted disease. Side effects: tracking your basal body temperature for either fertility or contraception is expensive. It doesn't have any side effects. Some women may choose to use the basal body temperature method for religious reasons. The basal body temperature method can also be used to detect pregnancy. So as you can see, in the screen is the example or the temperature of your body. The next is cervical mucus method. Cervical mucus method, also called the Billings ovulation method. The cervical mucus method is based on careful observation of mucus patterns during your menstrual cycle. Before ovulation, cervical secretion exchange, creating an environment that helps sperm travel through the cervix, uterus, and fallopian tubes to the egg. How to use it? To use the method, record your cervical secretion for several cycles, starting the day after your menstrual bleeding stops. Observe and record your cervical secretion on a daily chart, either on paper or with an app designed to track fertility signs. And the advantages is, why is the cervical mucus method used? The cervical mucus method helps people identify a woman's most fertile days each month. Some women who want to get pregnant use the cervical mucus method to pinpoint the best days of the month to have sex. Disadvantage: the major drawback of cervical mucus method is that it doesn't protect against sexual transmitted disease. Another disadvantage is that this method causes a higher risk for unintended pregnancy than other birth control. And side effects: the cervical mucus method is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Tracking your cervical mucus for either fertility or contraception is inexpensive and doesn't have any side effects. Some women choose to use the cervical mucus method for religious reason. So it's the same on other methods of natural methods. So as you can see in the picture is you can see the example of cervical mucus method. So the next of cervical mucus method is symptothermal methods. Symptothermal method, a fertility awareness method used to predict when a woman might be fertile. The method uses body temperature and other signs and symptoms of ovulation. How to use the temperature method? You take your temperature in the morning every day before you get out of bed. The cervical mucus method: you check your cervical mucus or vaginal discharge every day. The calendar method is you chart your menstrual cycle on a calendar. So it's the same on the three natural methods. So the disadvantages of the method are that intercourse must be restricted to only 7 to 13 days of the cycle. Women must take their temperature daily. The method cannot be used during fever episodes, and the method is inappropriate for use during lactation or near menopause. Side effects: both these methods are associated with side effects, particularly in combination with other medication and tobacco, and health complications including mood changes, acne, headaches, breast tenderness, pelvic pain, excessive bleeding, amenorrhea, nausea, weight gain, and uncommonly blood clots. So, the side effects of symptothermal methods is like on the methods of artificial. So, as you can see, these are the example of the symptothermal method. So, the second to the last of natural methods is ovulation detection. Ovulation detection is an ovulation home test. It's used by women. It helps determine the time in the menstrual cycle when getting pregnant is most likely. The test detects a rise in luteinizing hormone or LH in the urine. A rise in this hormone signals the ovary to release the egg. How to use? It's easy. All you have to do is to pee on a stick on strip or pee in a cup and dip the stick or strip into the cup and wait a few minutes for the indicator to appear. If the test lines show up darker than the control line, you're about to ovulate. Advantage: this test check the levels of this hormone. By detecting a surge in LH, it helps predict when you will ovulate. Knowing this information helps you and your partner time sex for pregnancy. So the disadvantages is limited detection. Ovulation test detect LH levels, but they don't give you an exact date of ovulation. Eggs may not emerge even after an LH surge. The side effects is mild pelvic or lower abdominal pain called mitral skimmers. Ovulation pain can feel like a sharp and dull cramp on the side of your abdomen where the ovary is releasing the egg. This ovulation side effect can last anywhere between a few minutes and a few hours. So as you can see, the picture, the example of ovulation detection or a device. So the last is coitus interruptus. Coitus interruptus, also known as withdrawal, is a traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. How to use is the same on the description. So, advantages. Some benefits of coitus interruptus are that the method, if used correctly, does not affect breastfeeding and is always available or primary use or use a backup methods. In addition, coitus interruptus involves no economic cost or use of chemical and has no direct associated health risk. disadvantage. Aside from the risk of not withdrawing in the time, the other major disadvantages regarding coitus interruptus is contraceptive involves the pre-ejaculatory fluid that appears after the penis becomes erect. A few drops of semen containing sperm may be deposited into the vagina without the knowledge of either partner. So, the side effects is coitus interruptus or withdrawal as a contraceptive technique does not make use of artificial devices. However, it does have several disadvantages. One, men discharge a small amount of semen before ejaculation. Number 2, men withdraw their penis late and inseminate the female. And the last is side effects include loss of sexual. So as you can see, that is the example of coitus interruptus. And that's all. Thank you for watching and listening of my explanation on artificial methods and natural methods.